Welcome back to News 2 at 4. Dr. Stevens joins us today, and we're talking about the top 5 facial changes associated with aging and how to solve the problems. So welcome back. And what are these top 5?
Well, inevitably, it's milestone ages when women turn 50. Most of our patients are women, and it's usually about subtle issues: lip lines, sagging skin around the neck, crow's feet around the eyes, and some drooping skin. And these things, you would think they happened overnight, and so they come to see us, and we try to help with some small things first.
All of a sudden, you hit a certain age, and you wake up, and you're like, "Oh my goodness!
Oh my God, what's happened? I've aged overnight." And so some of the things we can address with some non-invasive procedures, such as Botox, maybe some fillers, and even some skin peels. Lip lines are one of those things that I think can be helped with a few of those non-invasive procedures, such as Botox around the lips. Fillers we can inject right in some of the lines, and you can even plump up the lip. So I think we can help with some of those things. And a lot of those, smoking, as we've talked about before, create lip lines.
I was wondering, where do the lip lines mainly come from?
It's animation. People that are very happy and they're smiling all the time have these sort of things. And I read an article recently with women drinking out of water bottles because they're pursing their lips. And so there are various theories out there what causes these lines, but usually it's lines of animation. And that's why Botox, which paralyzes the muscle, can help alleviate some of these small problems, only on a temporary basis. But the point is that we see a lot of these ladies with some of the smaller problems, but some of the bigger problems is sagging skin, whether it's at the neck, the jowls, or the drooping brows, which may not be able to be addressed with just non-invasive procedures. They may need surgery.
Right.
And so we need to make the correct diagnosis and go from there.
Okay, what about crow's feet? Talk to me about that.
Crow's feet are much like lip lines, and they're lines of animation. We smile, and we're in the sun a lot, and as a matter of fact, we see more of them on the left side because we're driving from the left side of the car. And so if we can paralyze that muscle, which is the orbicularis oculi muscle, we may not see those as much. And so Botox works great, only on a temporary basis.
Okay, and then besides that, we can
do
other things.
You can do other things, maybe a little filler and some things of that sort can help.
Interesting.
But if we have sagging skin around the eyes, then that's a different issue. That requires a surgical procedure called blepharoplasty.
All right, now these are only temporary fixes.
Yes.
How often would you have to
redo, say, Botox? Well, Botox can last up to 6 months, maybe 9 months in some people, depending on how animated you are. Around the lip, you may need them a little more often because we're animating quite a bit.
Okay. Well, thank you so much, Dr. Stevens. We appreciate you coming in.
Glad to be here again.
You're watching WBRZ News 2 at 4. We'll be right back.